Hi, I'm Rebecca Ruiz, the Senior Features Writer at Mashable. I'm joined today by the CEO of Cedars-Sinai Hospital, Tom Priselac. Today, we'll be talking about community health. And first, Tom, I'd like to ask you a question about Cedars-Sinai Hospital. Some people who are watching may be familiar with the hospital based on some of the celebrity names that have been associated with over the years. But can you give us a sense of your patient population, who they are, and what their needs are?
Sure, I would be happy to talk a little bit about the patients we serve. You're right, Rebecca. There is an impression that we serve a very limited portion of the people who live in Los Angeles, but nothing could be further from the truth. The reality is that we serve a very diverse patient mix, not unlike the city of Los Angeles and county of Los Angeles, one of the most diverse populations really in the nation. We are the largest provider of Medicare services, for example, in the state of California, with a third of those individuals also eligible for the Medi-Cal program, so they're elderly and poor. And we are also one of the largest providers of Medi-Cal services among private hospitals in the state of California.
As we've also learned from the past year, it's critical to know who you're listening to, right? And where you're getting your information and data and anecdotes about what the community's needs are. Can you tell me more about your partners and when you go to the community to learn what they need, who you're listening to?
Sure. So, by way of introduction, I would just say that we have a couple of principles that we use to guide our community benefit work. They include, along the lines of what you just mentioned, first, listening to the community. First, listen to the community and the people who are there and the organizations serving the entire community. Another principle is this notion, as I just referred to, is health doesn't exist in a vacuum. And it's important to make sure we're addressing the root causes of people's medical condition. A third is our belief in strength in partnerships, and that's embedded in how we approach it. And then also focusing on sustainability. So taking all of those principles, but in first and most important, the point you raise about partnering with the right folks in the community, we do that in a couple of ways. One is in our community needs assessment work. That's a highly engaged effort that we undertake with the community clinics in Los Angeles, with the myriad of social service agencies that exist in Los Angeles, with government representatives of the various government entities in the Los Angeles area. And the whole point of that is to understand through the eyes of the community we're trying to serve what their needs really are.
And so, can you give us a few examples of how you've taken that feedback and implemented new programming or new initiatives to address those needs?
Sure. So, for example, one example I would give has to do with what program we call our emergency department navigators. So, homelessness is a major issue in Los Angeles, as I'm sure people watching this show are aware, as it is in other parts of the country. And individuals who experience homelessness already have significant medical needs in addition to their social needs, and they're at risk, at greater risk for those for having those conditions become even worse. And so, in a program we started a few years ago, putting in place what we call emergency department navigators, and these are individuals largely with a social work kind of background, and we ask them to work with the homeless individuals coming into our emergency department and literally getting them connected with the social service agencies or mental health agencies, as the case may be, to hopefully begin to make sure that those underlying social determinant situation, in this case homelessness, is being addressed in an effective way. We also have extensive relationships with the community clinics in Los Angeles and have had an active grant program with the community clinics for many years now.
And can you explain a little bit about how this might be different, a different approach, or and how you're innovating around these ideas in a way that could help some of your peers and colleagues take these ideas back to their health systems and do the same thing?
Well, I think it's really just, again, I think it almost all emerges, I think, from the dialogue. And if the organizations following that first principle of listening to the community, the community takes you, I think, where you need to go. And so another example of the kind of outreach we've done has been with the Los Angeles Unified School District, one of the largest school districts in the country, serving, again, a very diverse patient population, or school-age population. Regrettably, significant numbers of the children in the LA Unified School District are either victims or witnesses to trauma all too often. And so a program we started several years ago with the LA Unified School District is called Share and Care. And it uses art as the vehicle in working with young children and helping them to both understand and express their feelings as a result of that trauma. And we conduct pre and post surveys, both with the teachers as well as the parents of the children, to hopefully get an understanding of hopefully the impact that these efforts are making, and the results have been quite positive in that regard.
We know so much about how intervening in early childhood trauma can make a long-term difference in people's health outcomes. It sounds like a very important program. Can you talk about how you measure success for initiatives like these? It can feel hopeful and inspirational to be doing this work, but we also have to have results and that reflect success in the community. Can you talk a little bit about what that means and how you do it?
Our work in this area really reflects our approach to our other performance as an organization, and we try to focus on outcomes. Are we making a difference? Are we getting people healthier? Are we caring for people in the right way? And in the case of these programs, is it making a difference? And so, again, with regard to the Share and Care program, we engage in pre and post surveys to identify whether or not we're having an impact. One of the things we do in our community clinic initiative has to do with strengthening the capability of the community clinics with their infrastructure, whether that's electronic medical records or their ability to connect their clients to the community more effectively. And in that case, we engage in surveys with the community clinic staff themselves, getting the feedback from them directly. Are the things we're providing, are the funds we're providing making a difference? Are they being used in the right way? What else can or should be done? Help us answer the next question about how we can help you do your work even more effectively.
And speaking of learning, lastly, I want to ask you, what have you learned in the last year about how to serve a community, given the pandemic, given crises around racial injustice and socioeconomic crises that people are facing? Tell us what you learned.
We could spend hours talking about the lessons learned over the past year to 15 months. Clearly, as we all knew before, but brought into stark contrast, are the disparities in health and wellness across the United States and in different groups. That has actually been we've tried to make use of that in a very active way in our ongoing health disparities reduction efforts here at Cedars-Sinai, where we're examining our own work and making sure that patients, regardless of race, are receiving the same high quality of care that we want to see all of our patients. So being more intentional about measuring that and making sure we are in fact doing it. The other aspect, the other learning besides the impact of social determinants of health on individual health, I think was also illustrated in disparities that exist within the delivery system. And this past year, I think, has pointed out what some of us have been trying to suggest for some time, and that is that in the highest need communities, the level of funding for health services delivery really needs to be improved because those organizations need to have the same kind of capability and capacity that other parts of the health delivery system may have today. And so from a public policy standpoint, the need to address that is something that has emerged, I think, during this period as well.
Well, thank you so much for sharing these insights with us. Clearly, really important work as we move forward and thinking about how to treat patients holistically and reaching them where they are. Thank you.
You're very welcome. Thank you for the opportunity.